It's 6 in the morning. You're awake before the alarm again. You swing your legs over the side of the bed, you plant both feet on the floor, and you stand up. And for a moment, 3 seconds, maybe 4, the knee doesn't want to work. It's stiff. It's tight. It feels like it belongs to someone 20 years older than the rest of you. You take that first careful step toward the bathroom. Maybe you hold the edge of the dresser, and you tell yourself the same thing you tell yourself every single morning. It'll loosen up. Just give it a minute. And it does loosen up. That's the strange part. By the time the coffee's made, the knee feels almost normal, so you let it go. You decide it's just age. You decide this is what mornings are now. I want to stop you right there. Because what you do in those first 10 minutes after you stand up before the coffee, before you sit back down, matters more for that knee than almost anything else you'll do all day. And most people over 60 are doing it wrong. Not a little wrong. Backwards. If you're doing any of the 4 things I'm about to walk you through when you wake up, you are not protecting that knee. You're training it to stay stiff. You're making tomorrow morning harder than it has to be. And here's the frustrating part. Every one of these 4 mistakes feels like the careful, responsible choice. That's exactly why they're so easy to keep making, morning after morning, for years. So let's take them apart one at a time, and then I'll give you the simple thing to do instead. It's free. It takes about 10 minutes. And for a lot of people, it's the difference between dreading that first step and barely noticing it. Stay with me. Let me say something first, because I think you need to hear it. This is not in your head. That stiffness is real. The way the knee talks to you in the morning and then goes quiet by noon, that's a real pattern, with a real cause. And you're not imagining it, and you're not being dramatic about it. A lot of people your age quietly reorganize their whole morning around it. They stop taking the stairs first thing. They wait to leave the house until the knee comes online. They plan around it without ever quite admitting that's what they're doing. If that's you, you're in good company, and you're about to understand exactly why it happens. And here's the thing that should give you some hope. The cause is mostly mechanical. Mechanical problems have mechanical answers. This is not one of those situations where I'm going to tell you it's a mystery and you just have to live with it. You don't. Here's the belief we have to clear out of the way first. Most people carry around a picture of the knee as a set of brake pads. You've got a certain amount of pad, the thinking goes, and every step wears a little more off. And once it's gone, it's gone. So the smart move is to use it as little as possible and make it last. That picture feels like common sense. It's also the single most damaging idea you can hold about your own joints. Here's the reality. Your knee is not a machine that wears out faster the more you use it. That's the belief underneath almost all of this. And it's wrong in a very specific way. There's a whole aisle at the pharmacy built on that: belief creams, braces, wraps, supplements. Some of it helps a little. But none of it touches the thing we're about to talk about, because that thing costs nothing, and nobody makes money when you do it for free at home. So it doesn't get much airtime. Let me give it the airtime. Mistake number 1, treating stillness as protection. Here's what this looks like in real life. You wake up, the knee feels stiff and cranky, so you baby it. You lie there a little longer. You move gingerly through the whole morning. Maybe you skip your walk because the knee felt bad first thing and you didn't want to push it. And I understand exactly why you do this. You've been taught it your whole life. You twisted your ankle at 40, you stayed off it, it healed. So a sore knee must want the same thing, right? Rest it, protect it. Let it recover. Here's the problem. A joint is not a sprained ankle. Let me tell you something about the cartilage inside your knee that almost nobody explains at an appointment, because there isn't time. That smooth, slippery cushion on the ends of your bones has no blood supply of its own. None. The medical word is avascular, meaning no blood vessels running through it. Your muscles get fed by a pipeline of blood. Your cartilage doesn't. So how does it eat? It eats through movement. Every time you bend and gently load that joint, you squeeze fluid through the cartilage the way you'd squeeze water through a sponge. That fluid carries nutrients in and carries waste out. Bend the joint, the sponge drinks. Hold still, and the sponge stays dry. That's the mechanism. That's the whole thing. So when you lie there all morning trying to protect the knee, you're not protecting it. You're starving it. You're leaving the sponge dry. Let me make this concrete for you. Picture 2 people, both with the same amount of wear in the same knee. One of them treats every stiff morning as a warning and does less and less shorter walks, more sitting, careful all day. The other one moves gently through the stiffness, every day, and keeps going. Give it a year. The one who kept moving almost always ends up with the better knee, not because they had less wear to start, Because the moving fed the joint and kept the muscle around it strong, and the resting did the opposite. Same knee, two different roads. The road is the choice you make in the morning. And there's something almost unfair about how this feels from the inside. Rest feels responsible. Rest feels like the loving thing to do for a sore joint. So the person doing the damage feels like the careful one, and the person doing the right thing sometimes feels like they're pushing too hard. Your feelings about it are exactly backwards from the biology. That's worth knowing, because it's the reason so many people get this wrong for so long. And there's a second layer. Overnight, while you were still for 7 or 8 hours, the fluid inside the joint went thick and sluggish. It's supposed to. But that thick, reluctant fluid is a big part of why the first step feels like walking through wet sand. Doctors call it the gelling phenomenon. The joint gels during rest. Lie there longer, and you just let it stay gelled. Here's the tell, and this is worth knowing. The National Institute of Arthritis lists morning stiffness that clears in under 30 minutes of movement as a hallmark of ordinary wear and tear arthritis. Under 30 minutes, loosening as you move, that's the common, mechanical kind. We'll come back to what a longer stiffness might mean, because that part matters for your safety. So mistake 1 is stillness. The fix isn't rest. Hold that thought. Mistake number 2, reaching for the painkiller first. This one's quieter, and almost everyone does it. The knee's stiff, so the very first thing you do before you've really even moved is take the anti-inflammatory or the acetaminophen with your morning glass of water. Get ahead of it. Start the day without the ache. I get the logic. A dull ache is easier to move through than a sharp one. Nobody wants to start their morning wincing. But think about what that stiffness actually is. It's a signal. It's your joint telling you, in the only language it has, that it needs to be warmed up and moved. If you mute that signal with a pill before you've done any of the warming, you skip the one thing that would have actually loosened it. And here's what happens over months. You start leaning on the pill every single morning instead of the movement that would have made the pill less necessary in the first place. Now, I need to be very clear here, because this matters. I am not telling you to throw away your medication. If a doctor put you on something for your joints, or your heart, or anything else, you keep taking it exactly as prescribed until that same doctor tells you otherwise. Do not change a prescribed medicine based on a video, ever. The mistake isn't taking a pill. The mistake is reaching for it first, on reflex, before you've given movement a single chance and believing the pill is the whole answer. It isn't. It was never designed to be. Think of the stiffness like the warning light on your car's dashboard. The light comes on to tell you something under the hood needs attention. The painkiller first habit is like reaching under the dash and unscrewing the bulb so the light goes off. The light's gone. The problem isn't. And now you've lost the one thing that was telling you what your joint needed each morning. Here's the pattern I gently ask you to watch for in yourself. Does the morning pill work a little less well than it used to? Do you find yourself taking it a little earlier, or reaching for it on days you didn't used to? That creeping reliance is the tell. It's not that the medicine went bad. It's that the muscle underneath kept getting weaker while the pill quietly covered for it. The pill was buying you comfort and, without meaning to, borrowing it from your future. Movement does the opposite. Movement pays the comfort forward. Let me put the myth and the reality side by side, because this is the heart of it. The myth is that a good morning starts with getting the pain down as fast as possible. The reality is that a good morning starts with getting the joint moving as gently as possible, and the pain comes down on its own as it warms. So that's 2. Stillness and the pill first reflex. Mistake number 3. Yanking on a cold joint. Here's this one. You've heard your whole life that stretching is good for you. So you wake up and you go straight at it. You fold forward to reach your toes. You haul your heel up toward your backside. You try to force the stiffness out with one big, hard stretch. First thing, cold. And it feels productive. You're doing something. You're being proactive. But a cold, stiff joint at 6 in the morning is at its least pliable point of the entire day. The tissue around it hasn't warmed. Think about a piece of caramel straight out of the fridge. Pull it hard and it snaps, it resists, it tears. Warm that same caramel in your hand for a minute first, and now it stretches long and smooth. Your joint tissue is the caramel. In the morning, it's cold. That's why order matters so much here. The Mayo Clinic's own guidance on this is to warm up gently first, a few minutes of easy, small movements to raise the temperature and get the fluid flowing, and only then move into any real stretching or strengthening. Warm first, stretch second. Do it in the other order, and you're straining tissue that wasn't ready. So the deep morning stretch you thought was helping, if it's the first thing you do, it may be working against you. And I want to be fair to the instinct here, because it's not a foolish one. Stretching is good. Flexibility matters. The tissue around an arthritic knee genuinely does tend to get tight, and loosening it genuinely does help. The problem isn't the stretch. The problem is the timing and the force. First thing in the morning, cold. Hauling hard on a joint that's still gelled, that's the version that strains. The same stretch 20 minutes later, after you've moved and warmed up, is safe and helpful. There's a simple test you can use to know if you're stretching too hard. A good stretch feels like a mild, tolerable pull that eases as you hold it. A bad one feels sharp, or it makes the joint ache more, not less. If you feel sharp, you've gone past helpful and into straining. Back off. Warm up more first. The stretch will still be there in a few minutes, and your tissue will be ready for it. So that's 3. Stillness, the pill first reflex, and the cold force stretch. Notice something they share. Every one of them is you trying hard to do the right thing, and every one of them skips the warm-up your joint is quietly asking for. Quick thing. And then the 4th mistake, which is the one almost nobody ever catches. You and I both know your last appointment didn't sound like this. There wasn't time for any of it. If you want the version with time in it, subscribe and hit like. That's honestly the whole engine that keeps this going. All right, mistake 4. Mistake number 4, sitting straight back down. This is the sneaky one. You get up, the knees stiff, you shuffle out to the kitchen, and then you sit. Coffee, phone, the news. And for the next hour, sometimes 2, you barely move. That one window in the morning when your joint most needed gentle, repeated motion, you spent it in a chair. And it feels completely earned. You were up, you moved a little, you get to sit now. But remember the gelling. Every long stretch of stillness re-thickens that fluid and re-stiffens the joint all over again. So by mid-morning, when you finally get up to do something, you're starting from stiff a second time. The morning was never really the problem. The chair after the morning is the problem. And here's how you can feel this happening, once you know to notice it. Think about getting up after a long car ride, or standing up at the end of a church service, or a movie, when you've been in one seat for 2 hours. That first stand is stiff and slow, sometimes stiffer than the morning was. That's the gelling, live, in the middle of your day. Your joint gels anytime you hold it still long enough, not just overnight, which means the fix isn't only a morning thing. It's a don't sit still for too long thing. Every hour or so, if you've been sitting, stand up and move for a minute. You're turning the bottle over before it has a chance to fully separate. So the sitting back down mistake is really 2 mistakes wearing one coat. It wastes the good the morning movement did, and it starts a whole day of gel and stiffen every time you settle in for too long. So there they are, 4 mistakes. Lying still to protect it, reaching for the pill first, forcing a cold stretch, and sitting right back down. Every one of them feels responsible. Every one of them keeps that knee stiff. Now let me show you the model that's actually true. Because once you see it, the fix becomes obvious. Here's the reframe, and I want you to really sit with it. Your knee is not a hinge slowly wearing out, where every step spends a little more of a fixed amount of joint life. That picture, the one that makes rest feel safe, is the picture that keeps you stiff. Your knee is a joint that lubricates itself through motion. It was built to move. It's at its worst when it doesn't. And that morning stiffness you feel? It is far more a lubrication and fluid problem than a damage problem. That's the key. That's why free movement fixes it and rest doesn't. Let me prove it to you with something you already know from your own body. If the stiffness were pure damage, if it were the brake pads worn down to metal, then moving would make it worse, and resting would make it better. But that's not what you experience, is it? You experience the opposite. You move, and it eases. You rest, and it comes back. Your own morning has been telling you the truth all along. The thing that fixes it is motion. That's not a coincidence, and it's not willpower. It's the fluid doing exactly what fluid does. Let me give you the picture that makes this click. Picture a bottle of oil and vinegar salad dressing that's been sitting in the door of the fridge overnight. In the morning, it's separated. The thick part has settled to the bottom. The thin part has floated to the top, and if you tried to pour it right then, it would come out wrong, clumpy, uneven, reluctant. Now, how do you fix that? You don't fix it by shaking the cap harder, and you don't fix it by leaving it alone on the counter and hoping. You fix it by turning the bottle over, gently, a few times, until everything blends back together and it flows smooth again. Your joint fluid does something remarkably close to that overnight. When you lie still for 7 or 8 hours, the fluid inside your knee settles and thickens. It's designed to do that at rest. And that thick, settled fluid is a huge part of why the first step out of bed feels the way it does. Now, how do you fix it? Not by forcing it. That's the cold stretch. Mistake 3. Not by leaving it still. That's the chair. Mistake 4. And the lying there. Mistake 1. You fix it exactly the way you fix the dressing. Gentle, repeated motion that reblends the fluid and thins it back down, so it can coat the joint surfaces the way it's supposed to. Turn the bottle over, that's the whole idea. And now you can see, all at once, why all 4 mistakes fail. The stillness leaves the bottle separated. The cold, hard stretch is you shaking the cap and hoping force will do it. The pill hides the fact that the bottle's separated without ever blending it, and the chair lets it separate all over again an hour later. 4 different mistakes. One single misunderstanding underneath all of them, the idea that the answer is force or rest, when the answer is gentle motion. And now the sponge from earlier comes back too. Those same gentle movements press fresh fluid through the cartilage and feed it the only way it can be fed, because it has no blood supply of its own. So one simple thing, done right, does 2 jobs at once. It reblends the fluid, and it feeds the cushion. Free, in your bedroom, before breakfast. There's one more piece, and it's the one that turns a good morning into a good year. The muscle on the front of your thigh, the quadriceps, is what carries your knee. It's the shock absorber. When that muscle is strong, it soaks up the load with every step, and the joint barely feels it. When it's weak, the joint takes the hit directly, bone and cartilage absorbing what the muscle should have. And here's the hard truth the Mayo Clinic points to directly. Quadriceps weakness is extremely common in people with knee arthritis, and it feeds a vicious loop. Follow the loop with me, because this is the whole ballgame. The knee hurts, so you move less. So the thigh muscle, unused, gets weaker. So the knee takes on more load than before. So it hurts more, so you move even less. Round and round, tighter and tighter, and most people never see it, because each step feels reasonable on its own. Of course, you move less when it hurts. Of course, the muscle fades when you don't use it. Each link is sensible. The loop is a trap. The good news is the loop runs in reverse just as well. Strengthen the thigh, even a little, and the knee carries less. Carry less, and it hurts less. Hurt less, and you move more. Move more, and the thigh gets stronger still. The same loop spinning the other way, lifting you out instead of dragging you down. That reverse loop is what you start tomorrow morning. With one small movement you can do lying in bed before your feet ever hit the floor. Before I give you the routine, one quick honest note, and then we're right back to the knee. Some of that morning tightness isn't only inside the joint. Part of it is fluid that pools and settles in the lower legs and around the joints overnight, something the body does more of after 60, when it moves fluid more slowly than it used to. If that particular piece interests you, I put together a short guide on it called The Drainage Protocol. It's about why the body holds on to fluid after 60, and a simple 30-day reset to help move it out. The link's in the description if you want it. That's it, back to the knee. So, here's what to do every morning. The whole thing takes about 5 to 10 minutes, and none of it should hurt. Talk to your doctor or a physical therapist before you start, especially if you've had a knee replacement, a recent injury, or you're not sure what's going on in there. This is general education, not a diagnosis for your specific knee. Start before your feet ever touch the floor. You're still lying in bed. Point your toes down, then flex them up toward you. Slow. Do that 10 to 15 times. It's called ankle pumps, and it starts moving fluid up out of the lower leg before you ask the knee to carry any weight. Next, still in bed, heel slides. Slide one heel up toward your body, bending the knee as far as is comfortable, then slide it back down straight. 10 times, each leg. Gentle. This is you turning the bottle over the first easy reblending of the fluid. Third, still lying down, quad sets. Straighten your leg and gently press the back of your knee down into the bed while you tighten the muscle on top of your thigh. Hold a slow count of 5. Relax. 10 times each leg. This is the single most important move in the whole routine because it's how you start rebuilding that shock absorber muscle, and you can do it before you've even stood up. The Mayo Clinic and the Cleveland Clinic both put quad sets at the center of home care for knee arthritis for exactly this reason. Now you stand. Hold on to something stable, a dresser, a bed frame, a wall. Small, slow knee bends. Only a quarter of the way down, not deep. 10 of them. Then, shift your weight gently side to side a few times. You're warming the joint now, with the fluid already loosened from the bedwork. Fifth, sit to stand. Find a firm chair. Stand up, sit down, stand up. Sit down slow and controlled, 5 to 8 times. Use your hands to push off if you need to, and keep your knees from sliding out past your toes. This is the best thigh strengthener there is, and it's the exact motion you use 100 times a day. And then walk. Even 2 or 3 minutes around the house before you let yourself sit down for coffee. This is where you break mistake 4 before it can happen. Now, I know how a list like that can sound like one more chore piled onto a morning that's already full. So let me take the pressure off. You do not have to do this perfectly. You do not have to count reps like a drill sergeant. If some mornings you only get through the bed movements before life pulls you out of the room, those bed movements alone are worth a great deal, because they're the ones that reblend the fluid before you stand. The ankle pumps, the heel slides, the quad sets, those 3 done in bed are the core. Everything after that is a bonus. Start with the core, add the rest as it becomes a habit. And a small trick that helps people actually stick with it. Tie it to something you already do without thinking. You already wake up. You already reach for your glasses, or your phone, or the lamp. Let that be the cue. Before the feet hit the floor, the ankles pump. Attach the new habit to the old one, and you'll stop having to remember it. Here's the order that ties it all together. You warmed up first, in bed, then you moved and strengthened. Only now, at the end, if you want to add a gentle calf or thigh stretch, your tissue is finally warm enough to take it. Warm, then stretch. Never the reverse. One rule over everything else. None of this should cause sharp pain. A little stiffness working itself loose, that's fine, that's the point. But sharp pain, or pain that gets worse as you go instead of better, is a stop sign. Stop, and check with a doctor or physical therapist. The Cleveland Clinic says it plainly, you might feel a little tired or worked afterward, but you should not feel worse. So, what should you expect? Let me be honest with you, because the honesty is the point of this channel. In the first few days, the change you're most likely to notice is small and specific. That first step out of bed gets a little easier, and the stiffness clears a little faster. That's the fluid reblending sooner. That's the quickest win, and it can come fast. Over the next 2 to 4 weeks, as the thigh muscle starts to wake up and get stronger, the knee gets more support through the whole day, and a lot of people find the general all-day ache eases too. That's slower. That's the muscle rebuilding, and muscle takes weeks, not days. Now, the honest part, this is not a cure. The Mayo Clinic is direct about it. There is no cure for the underlying wear, and nothing here changes that. What this does is real anyway. It can meaningfully reduce stiffness and improve how the knee works day to day. For a lot of people, that's not nothing. That's a better morning, and a better morning is a better day. And it only works if you keep it up. Consistency beats intensity, every time. Skip a week, and the gelling wins again. The routine is small on purpose, so it's easy enough to actually do every single day. One more honest word about progress, because it's where people give up. It won't be a straight line. You'll have a great morning, and then a stiff one 2 days later, and it's easy to read that stiff morning as proof it isn't working. It isn't proof of anything. Joints have good days and bad days for all sorts of reasons. The weather, how you slept, what you did yesterday. Watch the trend over a month, not the score on any single morning. If the general direction over 4 weeks is easier, you're winning, even with the occasional bad day mixed in. That's how real improvement actually looks. Bumpy and upward. Now the part I will not skip, because your safety matters more than the routine. Most morning knee stiffness is the ordinary mechanical kind we've been talking about, the kind that loosens within about 30 minutes of moving. But some morning stiffness is telling you something different, and you need to know the difference. If your morning stiffness lasts well past 30 or 45 minutes closer to an hour, Most mornings that can point to an inflammatory arthritis, like rheumatoid arthritis. That's a different condition with a different cause, and it needs different care. Don't try to walk that one off. Get it looked at. If a single knee is hot, red, and swollen, especially if you also have a fever that is not a give it a minute morning, that can mean an infection or a gout flare, and it can be serious. Call your doctor that day. If the knee suddenly gives out under you, or locks so you can't straighten it, or the pain comes on sharp and severe, that's worth getting checked promptly. And here's one that has nothing to do with the joint, but that you should know. If you notice swelling, warmth, or tenderness in just one calf, one side, not both, that is not an arthritis sign, and it can point to a blood clot. Don't wait on that one. Get it seen promptly. And in every case, if the pain keeps getting worse instead of better, with gentle movement, see a clinician. Don't start, stop, or change any prescribed medication on your own. Talk to the doctor who prescribed it. Always. Before you go, do one thing for me. Tell me your decade in the comments. 60s, 70s, 80s? I ask because this morning routine shifts a little depending on where you are, and I genuinely want to know who I'm writing the next one for. So, tomorrow morning, before the coffee, before the chair, give that knee 10 minutes. Pump the ankles, slide the heels, wake up the thigh, stand, and move a little before you sit. Turn the bottle over, let it blend, then go start your day. I'll see you in the next one.